but this one is a softball, I believe. So anyone can go first, but from our amazing panelists, I would love to hear, what is your role in the organization and why is health and or racial equity important to you and your organization? And I'll ask it one more time, but what is your role in the organization and why is health and or racial equity important to you and your organization? And it's in the chat as well.
I can jump in here. If that's all right.
Of
Dante
course.
Ferguson, now Chief People Officer, actually, but
Okay.
yeah, so things, but really for us, we work within the environmental space. We're one of the largest and oldest environmentally focused nonprofit organizations in the state of Ohio. And if you know anything about that movement, it has been a very white movement historically. But over the last few years, as the idea of intersectionality, I think, has taken more of a hold in, popular conversations. This idea that we have to expand the idea of the environment, right? And bring more people in to be a part of our movement in order to effectuate change. And so for us, I think that health and racial equity are central in that conversation. When you think about the things that impact communities of color from an environmental perspective, you really can't talk about the environment without paying attention to those impacts. And then it even spreads over into the idea of who has access in the country in terms of access to environmental spaces, but also access to things like the voting booth, where you go to vote on things both locally as it affects your environment and nationally. And so over the last couple of years, we've also put a lot of work in our with our democratic and democracy pieces that we've added and intensified our focus on. So again, for us, it's just you can't really think about the environment or address the issues of the environment without paying a special attention to health and racial equity impacts and outcomes.
Yeah, I really appreciate that, Dante. I think I love your organization for that reason and many reasons. But I think a lot of folks haven't made that connection, right? The fact that the environment really is impacted by health equity and vice versa. And so I've loved your organization for being able to draw those connections. I would love to hear Crista, Heidi, anything from you all?
Sure, I'm happy to go. I'm Crista Taylor. I'm the president and CEO of a nonprofit organization, Behavioral Health System Baltimore. We refer to ourselves as BHSB. Everything is an acronym in Maryland. So we've been working towards becoming an anti-racist organization for several years. The reason for that is our role as a nonprofit is we provide public functions. So we manage a large amount of public dollars that go into service delivery to individuals, families, and communities impacted by mental illness and substance use. And white supremacy is everywhere, and systemic oppression is everywhere. And if we were going to do our job and do it well, we have to take this on, and we have to work towards becoming an anti-racist organization so that we can then do what is needed to have the right impact in the community. So we've been focusing a lot internally in our work. And I guess to sum it up, really, if we didn't do this, we wouldn't be doing our jobs. So that is why we're focused on it, because the behavioral health system is a system, and it is an oppressive system. We aren't government, but we manage government funding. That's another system of oppression, and we need to be focusing on this if we're going to do our job. And it's the right thing to do, and we've been committed to it for several years.
I really appreciate that, Crista. I think when I think of your organization, bravery is the first word that comes to mind. You all are unafraid to say the words. You are unafraid to make those connections, much like Dante and his team. And I'm just appreciative of folks who recognize these larger systems that we operate in. And so again, thank you for your bravery. And I know you all have changed many lives and will continue to change many lives for the better, because you're unafraid to say the thing and to tackle the thing. So thank you. Heidi?
Yeah. Well, hello, everybody. I'm Heidi Haley Franklin, and my role is at the Alzheimer's Association is to change people's lives who are impacted by dementia so they feel less alone and can live as well as they can as the disease progresses in any community. And really, at the Alzheimer's Association, we believe that engaging diverse perspectives and diverse communities is critical to achieving health equity and racial equity, and want to see a day where all communities have equal access to early detection and diagnosis of mild cognitive impairment or any type of dementia, and have access to risk reduction and quality care. So Crista, I might be pinging you. Since you're in a health system, maybe we can put our heads together and figure out a way to tackle dementia in a health system in Baltimore. But what a lot of people don't know about dementia is that underrepresented and underserved communities are disproportionately impacted by the disease. And yet these communities are less likely to be diagnosed, less likely to be recruited to participate in research, and also less likely to have access to the programs that they deserve. And it's unacceptable to us, and it has to change. And I am committed to making that change that all communities deserve.
I really appreciate you, Heidi. Alzheimer's is something that's affected my family personally. And I would love to think that racial disparities didn't play a role in some of the outcomes. And I think that would be naive of me. And so hearing your passion for bringing that to the forefront, it just, it gives me goosebumps.